welcome back to our YouTube channel. My name is Ngozi, and today we're going to be talking about urinary tract infection or UTIs. UTIs are among the most common bacterial infections worldwide, affecting millions of people. Despite their prevalence, they're often misunderstood. So let's explore what UTIs are, who they affect, and how to prevent and treat them. UTIs occur when bacteria, usually from the digestive tract, enter and multiply into the urinary system. The most common culprit is called E. coli. It's responsible for about 80 to 90% of cases. Other bacteria that can cause UTIs include Klebsiella pneumonia or even Staphylococcus, just to name a few. Who can get a UTI? Women are 30 times more likely to get a UTI compared to men. Because of their shorter urethra and its proximity to the anus, it makes bacterial entry easier. Older adults, due to their weakened immune system and potential incomplete bladder emptying, also increases their risk for getting UTIs. Thirdly, people with urinary catheters or blockages such as kidney stones or enlarged prostate. Those with weakened immune system, including individuals with diabetes or those that are undergoing chemotherapy, increases their risk for UTI. Sexually active individuals, especially women, postmenopausal women, due to their decreased level of estrogen, can alter the urinary tract bacterial balance. Now let's talk about how we categorize UTI based on their locations. Number one, urethritis, infection of the urethra, often causing burning with urination and discharge. Number two, cystitis, which is bladder infection. This is the most common, typically resulting in frequent painful urination and lower abdominal discomfort. Number three, pyelonephritis, kidney infection, which is the most serious. It can lead to permanent kidney damage if left untreated. What are the most common symptoms that we see when a patient comes in complaining of UTIs? The most common symptoms you see: frequent urgent need to urinate. So there's always that frequency. They just need to go. They need to go. And there's the burning sensation during urination. They pass small amounts of urine frequently, or the urine can be cloudy, dark, bloody, or strong smelling urine. There's also pelvic pain associated in women, especially in the center of the pelvis and around the pubic bone. In severe cases, you can have fever, chills, nausea, vomiting, or even back or side pain. How do we detect UTIs in individual, or when do we suspect it? So for elderly patients, you can notice behavioral change or confusion, which sometimes can only be the sign of UTI. They might not have other symptoms that you would typically see, like fever, nausea, if it's severe. How do we diagnose UTI? UTIs are typically diagnosed by collecting a urine sample to check for bacteria. If we see elevated white blood cells, or sometimes even the red blood cells, in some cases, we might need urine culture. And by getting a urine culture, it's going to help us identify the specific type of bacteria, which will help determine the most effective antibiotic to use for treatment. Additional tests can be done, such as ultrasounds, CAT scans, or even cystoscopy may be used for recurrent or complicated UTIs. How do we treat UTIs? Treatment usually involves antibiotics. Common ones include Bactrim, Septra, fosfomycin, macrobid, Keflex. Like I said, antibiotic we use depends on what type of bacteria we're dealing with. Now, the type and duration depend on the infection severity and the patient's health. It's very, very crucial for patients to always complete the full course of antibiotics that have been prescribed, because if you don't, you might think, okay, if I just use it for 2-3 days, then my infection will clear because I'm not getting the symptoms. But if you don't complete your antibiotics, the infection can reoccur. So we always encourage patients, complete your full dose to prevent antibiotic resistance and recurrent infections. What are some other ways that we can use to relieve symptoms? Drink plenty of water to flush out that bacteria. You can use a heating pad to reduce bladder pressure or discomfort. Avoid bladder irritants such as caffeine, alcohol, spicy foods. It's okay to take over the counter pain relievers if needed, and also try urinary analgesics such as phenylcyperidine just for temporary relief. In my opinion, prevention is key. How can you even prevent UTIs from happening in the first place? I'm just going to give you a few strategies. Stay hydrated. Aim for 6 to 8 glasses of water per day. Always practice good hygiene, especially wiping from front to back after using the restroom. Urinate after sexual intercourse to help flush out that bacteria. Do not hold your urine for long periods of time. It increases your risk for getting a UTI. Wear breathable cotton underwear, especially women, 100% cotton. That really helps you. Avoid using irritating feminine hygiene products in the genital area. That just increases your risk. Consider using probiotics, especially those that contain lactobacillus. So those are my tips that you can use to prevent UTIs. If you enjoyed this our YouTube channel, please continue to subscribe, like, and share, and watch out for other new videos.